In today's video, we're going over advanced shoulder instability exercises. So stage one in the rehab process is obviously going to be starting with the basics. Now we did a video on this. We went comprehensive through the starting of what your shoulder rehab should be for shoulder instability patients. I'll leave a link in the description, in the show notes. You guys should probably watch that before continuing on to this video. Now we have two main goals with advanced rehab. So one, we want to restore stability at end ranges of motion. So if a patient has anterior instability and they want to get back to, let's say, pitching, I had to restore this position, right? And this is probably going to be something that's a little bit provocative early on in rehab, but later rehab, hopefully it doesn't hurt anymore. We have to get really stable here because the sport obviously requires this, okay? Number two, we already talked about this a little bit, is sport specificity. So we have to figure out what the athlete needs to be able to get back to and then get very strong and stable there. So using the prior example for a pitcher, we need to get stable if they have anterior instability and end range abduction, external rotation. We also have to get very stable while we're throwing a baseball. Okay? If I have an Olympic weightlifter, and let's say they have a posterior or inferior instability issue, I have to restore the ability to go to end range flexion, so they're not feeling apprehension there, but I have to get ready to tolerate heavy loads here. So if I'm snatching, that could be several hundred pounds catching this position right here, I have to be strong and stable there, right? So we just choose exercise that mimic those forces, starting with easier exercise and eventually progressing towards hard exercises over the course of time. So we're going to want to advance our rotator cuff exercises and our scapular stability exercises, and a very easy way to do this is to go from exercises where your elbow is close to your body to exercise where your arms are a little bit more overhead, all right? So your regular external rotation, internal rotation with your elbow at the side is going to turn into 90-90 external rotation, internal rotation. Scat, why don't you show us a few repetitions right here. So we'll start off 90-90 internal rotation. Go ahead, 1 or 2 reps. You can also get fancy and add an overhead press in this position. Come right back down, another internal rotation. Yep. We also want to work the external rotator, so let's have you spin. And we'll do, let's use the left side arm just so the camera can see easily. Yep, very good. External rotation, let's do 2 or 3 reps here. Very good. And then this last one, let's add the overhead press. Very good. So getting more and more challenging. We can also go from working shoulder extension, where your elbow is close to your side at the beginning stage of rehab, to doing more T's and Y's. Do you mind showing us that right here? Very good. So show me a T straight across the body. Very good. Let's show a few Y's. Yep, nice and easy way to advance these exercises. For folks that have anterior instability, we're trying to get the shoulder to be able to tolerate end range horizontal abduction, end range external rotation, and also end range extension, although sometimes we don't tend to think about this with anterior instability. So what we can do is you can choose exercises that challenge those extreme end ranges. The first thing we'll try is going to be a pec fly, or kind of a reverse T. So Scat's going to start with their hand at shoulder level. Go ahead, don't worry about me. And then let it stretch you a little bit into end range horizontal abduction. You have to be careful for your patient to have anterior instability here. The thing is, if you want to get them back playing football, their arm is probably going to get ripped into this position at some point. So if we don't have good stability here in the gym, chances are it's not going to work out really well when they get on the field. Right? Next thing we can try is just end range 90-90 internal rotation. And I want you to stretch into external rotation on the way back. Yep, and you don't have to do the fly. Let's just keep the elbow in place. Yep, and then go ahead and do an internal rotation. Very good. So what we're doing is we're going to end range external rotation where folks tend to have some instability and building a little bit of strength here. Now, Scat gave you a little sneak peek, but you can also do a fly with this motion. So going to end range horizontal abduction, external rotation, and coming back into a fly position. Very good. So as we come back, we're challenging all those structures in the front side of the shoulder, reaching all the way through, hopefully not causing a bunch of apprehension. Don't use this in your patients, obviously, if it's not feeling good. And here are some of my favorite exercises for folks that have posterior instability. Now keep in mind, folks that have posterior instability, normally they don't tolerate end range horizontal abduction, flexion, and internal rotation, okay? Now one of the exercises I like most for these folks is going to be a T. But when we perform a classic T, so go ahead and do a T for me, Scat. Hardest part of the motion is going to be when the arm is straight out to the side like so. When she brings her arm out in front of her, this is the easiest part of the motion, right? If we want to make it harder when the arm is all the way across the body, all we have to do is have your patient turn towards me, Scat, and then now when she performs the motion, go ahead and pull. The hardest part of the motion is going to be a little bit closer to the area where these folks generally experience a little bit of instability, right? So maybe you start off with your posterior instability patients performing a regular T, but over the course of time, I highly recommend you switch to this because you're going to get stronger in the position where they previously had apprehension. Another movement that's challenging for folks with posterior instability is going to be getting into end range internal rotation, especially when your arm is across the body or horizontally adducted. So we can train this motion pretty easily with a light, go light with your dumbbells for these patients and make sure they don't have apprehension here before you start wailing in this position and using a lot of load. We're gonna have Scap bring her arm up to 90 degrees. From here, she's gonna horizontally adduct, and she's gonna grab onto her elbow underneath and just perform give your arm a platform with your opposite side hand and perform a few resisted external rotation in this position. So as you can see, we're going into the position of instability under control with load, and we're developing a little bit of strength here. This is definitely not something to start early on with your patients if they feel a lot of apprehension, but once they start to progress, it's a great one. So in those same folks with posterior instability, it's not just horizontal adduction they don't tolerate well, it's adding in a little bit of flexion, arm across the body just like this. So if we're trying to get a little bit more stretch with the arm across the body into flexion, if we do this exercise right here, right? So we're doing ourselves a T, and based on the nature of the pull, so now the cable is up quite a bit higher and we're kneeling, the cable is pulling us into flexion and horizontal adduction, which is going to be a little more challenging for your posterior instability patients. Now remember, in your patients that have posterior instability, axial forces, so think about a bench press, when you lock the weight out at the lockout portion of the lift, the weight is trying to push the shoulder backwards or posteriorly in the socket. That's a challenging thing for folks who have posterior instability. So what we can do in order to mimic these forces is a closed chain T. I like to start these off elevated because they're very hard, but you can work your way down to the floor. I'll give you a few exercise ideas later to make this even more challenging. But what we're seeing right here with Scap is that she is actually going into horizontal adduction and horizontal abduction, and you also have that combined axial load, so essentially the ball is trying to pop through the back of the socket. Hopefully all the muscles around the joint are going to protect it. So again, an advanced exercise, wouldn't start your patient with this, but towards the end stage of rehab, it's phenomenal. Folks that have pure inferior instability often have trouble fully overhead. So when you go fully overhead, two things happen. So for one, we stretch the inferior capsule. Two, if you have a weight support overhead, that's gonna pull the ball directly down in the socket, right? So the way we strengthen this in end stage rehab is by carrying things overhead. So we're gonna have Scap do a waiter's walk. Essentially, it's gonna press that weight overhead. And usually I like to walk with my patients, but we're just gonna show you Scap marching in place right here. So we're trying to get that weight fully overhead, get nice and stable, and build some stability there.
To go along with the video today, I have a little gift for you. It's an evidence-based cheat sheet for shoulder instability. It's a 4-page PDF that goes over everything you need to know about shoulder instability. We go over prevalence, anatomy, joint arthrokinematics, risk factors, and different types of instability, causes of instability, whether or not your patient should undergo surgery or have conservative care like physical therapy, and finally, rehab implications for all the different types of instability. So if you're looking to get up to speed about shoulder instability in less than 10 minutes, then this PDF is for you. I'll leave a link in the show notes in the description. Go ahead and click on that and then download it and then get back to what you're learning about right now.
Now, the next part of this video, I'm just gonna go over a bunch of advanced exercises. Now, a lot of these you probably never wanna use with most of your patients, but I wanna give you a bunch of ideas because some of these exercises are gonna resonate really well with some of your athletes and some aren't. So don't feel like you have to use all of them, but again, some ideas you can use with your treatments. Next, we'll go over some open chain exercise ideas. Generally speaking, we make these harder by working more into end ranges, by going to end ranges faster, using more loads, as well as potentially closing your eyes. So here are some ideas for you. You can also advance our exercise by adding a little bit of speed. Just think about the specificity example from before. If I have someone that has anterior instability and wants to get back to throwing, we probably want to get stable in this position, and we probably want to use something that's fast and dynamic because it mimics throwing a baseball. So we have Catherine right here. We're going to go over a few drills with the ball. So the first thing we'll do is 90-90 dribbles against the wall. Very good. We can also go into a T position, arms straight and bouncing against the wall. And lastly, we can try a Y and bring the arm up a little bit higher. Excellent work. So you all know that getting the brain involved in your rehab is actually going to be really important. Sometimes you want to add that neurocognitive demand. One way to do that is while your patient's doing their bounces, you actually take their phone, put it to the fitness pain-free channel, and put it up on the opposite side. Then you have them simultaneously hit the like button and subscribe while they're dribbling against the wall. Very helpful for shoulder instability. For posterior instability, we want to drive a little plyometric adaptation across the body through here. So we can do a cross-body T and just practice some ball catches just like so. Excellent, you take a breather here. We can also incorporate some plyometrics to end range internal rotation. So essentially, we're gonna have Catherine bring her arm up across the body into some horizontal adduction, then practice some ball catches. So there you guys have it, a lot of advanced shoulder instability exercise ideas. If you have a patient, you gave them enough rehab time, you progress them from easy to more advanced, and they're still experiencing a lot of apprehension, and they need to get back to a sport that requires they have stability in those positions, it might be time to refer that patient to a doctor. Now I have a video for you, I'll leave a link in the corner. We're gonna go over surgery versus conservative care for folks with shoulder instability, and when it's right to do conservative care, and when it's right to refer back to the surgeon. Click on this link, and I'll see you there.